In accordance with South Africa's constitution, no one may be refused emergency medical treatment. This provision ensures that emergency healthcare must be provided unconditionally by both public and private health facilities. But this has not stopped protesters from the March and Operation Dudula movements from allegedly preventing some individuals based on their immigration status or citizenship from entering public healthcare facilities to access much-needed medical care in KwaZulu-Natal and Gauteng. To talk more about who's entitled to access healthcare in South Africa, we are joined by Nomzamo Zondo, who is the Executive Director of Socio-Economic Rights Institute of South Africa. Nomzamo, thank you. Thanks very much for being with us.
Good morning, Leanne. Thank you for having me.
Let's start with the law. So we'll start off the interview and then we move from there. I've said to the point that the Constitution says that anybody can access the healthcare system here in South Africa. When we talk about anyone, who are we talking about?
So our Constitution is very interesting in that it is very clear when it means anyone. It also has provisions in the Constitution that says citizens. So in relation to the right to health care, it's clearly anyone, which means anyone who is in South Africa. And this is carried through in the National Health Act, which speaks about the population of South Africa. It does not say citizens.
Okay. If we're talking about any exceptions, who would we be referring to if there are exceptions? I mean, if somebody is in South Africa illegally, would they be entitled to receive this health care as well?
That is correct. If they're in South Africa, they'll be entitled to this. In fact, this is also the understanding of government. And I remember that in 2022, September, when Minister Joe Phaahla went to Kalafong after similar incidents, he issued a statement setting out clearly that as the Department of Health, they have a right to treat everyone in the population.
Okay. So we now look, and that's the reality. That's what the law says. But the reality is that as South Africa, from load shedding in hospitals, the lack of medicine, staff burnout, the reality is that our healthcare system is in crisis right now. And it seems that they cannot treat and support South African citizens. And then adding to that is, as you say, the Constitution saying that everybody has the right to it. What is your response to the movement that we are seeing and the blocking of foreigners getting the health care that the Constitution says they're entitled to? What is your reaction to this?
So, Leanne, we were actually instructed in 2023 to bring a case to interdict Dudula specifically from such actions because we understand them to be unlawful. In fact, we argued that case on the 10th and the 11th of June. Dudula was in court, and we are not sure what this means because this new wave of actions happened immediately after that court hearing. We don't know if it's a matter of them saying they have no respect for the courts, or that even when if the court case is won by our clients, the four movements who brought it, that they will not respect that court order. But they set through arguments about why their actions are unlawful.
But if we look at their case and what they're putting forward in terms of the fact that South Africans are not receiving adequate health care and that the system is overburdened, do they have a case to answer to? I mean, do they have a right to be doing what they're doing, saying that South African citizens should be getting priority when it comes to healthcare, but that doesn't seem to be the case?
So they have a right to protest, which means they could be in the Department of Health, they could be outside facilities, but they definitely do not have a right to blockade and to block patients from accessing healthcare. I think we all understand that, as you put it, our healthcare system is under crisis. Again, Minister Joe Phaahla, when he issued his statement, makes it clear that it's under crisis for a number of reasons. And the issue of migrants is but one.
Yeah.
And as the Department of Health, they have an obligation to address those issues, and that as the Department of Health, they are aware of the issue of numbers in the system. I mean, my colleagues from Section 27, I think, were sharing in another SABC platform that 84% of South Africans are within the public healthcare system. And as we know, migrants only make up about 4% of the population. So even if we accept that, let's say, I don't know under what miracle the law changes, the constitution is changed, and migrants are not in the system, we're still going to be dealing with the same crisis. That the number, that the 84% that is being serviced by the public healthcare system is going to continue to experience the same challenges for different reasons, from corruption to incapacity to mismanagement. And these protests don't solve that. In fact, again, I apologize to Mr. Pasha for bringing him in again to say his call in 2022 was, leave this to government to do. Let the Department of Health address this issue. He also pointed out in his statement that they've been discussing it even within the ANC. So I think our proposal, and it was the position that we took even in the legal case that we brought on behalf of our clients, is that this should be in the government's hands. If March on March Operation Dudula have these concerns, there are places to put pressure on government to address the crisis in the healthcare system.
So what I'm gathering from you is that the issue here isn't really immigrants, because you've given us the statistics, you've put them out there. It in fact is rather the failure to build and maintain a healthcare system that can serve the population. Is that what we should be looking at, as opposed to scapegoating the entire issue onto the immigrants that are using the same system?
Precisely. And the reason we make that suggestion is for the best interests of people living in South Africa. If we spend all of our time on a false silver bullet, we're going to find ourselves in 5 years' time, in 10 years' time, with a system that's a lot more broken. And so I think the call to people in March on March, to people in Operation Dudula, is to be thinking about solutions, engagement within civil society, engaging government about addressing and fixing the healthcare system.
The problem is that we hear worrying remarks from politicians and public servants that almost fuel this xenophobic aggression and attacks. I mean, is this something that you're concerned about as well? Because standing on a public platform and saying, we are talking about Dudula, but there are politicians and there are many incidents where they have turned and said, you know, that this is the problem. This is why our system is the way it is.
Of course, I mean, I don't want to mention any names, but I would understand. I myself am in management in an organization. I would never want to say that the organization is failing because of me or because of my inability to manage. I would find it easier to point out to other troubles. And I imagine that this is an easier route for many within government who do not want to take responsibility. Yeah. And I also think, to be fair to government, is that before 1994, we had a system that didn't care for the majority of the population. And from 1994 to now, we've had to build a country that is for all, that provides for everyone. And that must be difficult, building that infrastructure, maintaining that infrastructure, managing even with new challenges that come in must be difficult. But we would call on government to take its place as the people governing the healthcare sector and the healthcare system, to put, as they've even tried, the National Health Insurance as an example, to bring in new creative ways to make sure that the obligation on it to provide healthcare services to the whole country is met.
Yeah. I mean, there is a flawed system as well, and as much as your statistics are speaking to 4% of the population are immigrants, the rest are South Africans, we have many illegal immigrants in the country, and it's very hard to keep a toll because our borders are so porous and because of the situation that we see there. And we hear stories where many immigrants come over the border illegally to get medical treatment from our facilities because perhaps the neighboring country's healthcare systems has fallen apart. But what is your response to this? Because you now, once you're in the country, are obligated to treat them. But the reality is that South Africans born and bred in the country who have passports, who are entitled to the healthcare system, are pushed out because there's just not enough space and there's not enough to go around. Yes, we can blame the medical situation, but perhaps there's a lot more that we need to look at as well, and introduce a tiered system or introduce something that can assist South Africans before it assists others. What do you think about those assertions?
So look, I think the first thing, I thought that we'll probably get to this point. The issue of numbers is difficult for everyone. I gave you the numbers according to Stats SA, which is based on the last census. Many people want to believe that, of course, even that number is not accurate, that we have as many immigrants in the country as we have citizens. Others would want to say the numbers are much more, but without a base for those numbers, it's really impossible. As we sit in this interview, both you and I are women. So if anyone took stats from us, they would say South Africa is mainly women. Half of them are black, half of them are white. And the reality is that what we have is the census, that's the data that we have. I accept precisely the premise that there are people who are not in the population, so could have been counted by the census, who've come into the country to receive those medical services. And I expect, in fact, that the Ministry of Health has a calculation for that, right? And it is difficult to count what the number is in those circumstances, but it's definitely not going to be double the population or 25% more. And it is then the question that you've put of, shouldn't there be a tiered system?
Yeah.
And in the healthcare system right now, there was an attempt at least to bring in a tiered system. There is a differentiation between South Africans and foreign nationals, which is based on payment of fees. And so that is an attempt by government to bring in a tiered system. But again, as I said earlier, no one is saying that this should not be addressed. If we're saying access of healthcare by immigrants, then we should leave it to those who have the data, those who have power to make policy and to make legislation to do that. It should not be something that's being dealt with by every Tom, Dick, and Harry in the corner of a healthcare facility.
Yeah, indeed. This is such a long conversation we need to have, but thank you for your time, and it's definitely a starting point for a conversation that I think we need to perhaps maybe go much deeper into, even invite a few more voices and guests into this conversation, which is a very important one for South Africans. Nomzamo Zondo, Executive Director of Socio-Economic Rights Institute of South Africa, talking to us about that worrying trend that we are seeing, where protests have allegedly prevented some individuals based on their immigration status or citizenship from entering public health care facilities to access much needed medical care, even though the country's constitution says that they are entitled to it.